I'm sorry, that's the problem with Instagram Live. Sometimes it gets hooked. I hope this will work now. I'm restarting a new session. So again, good evening and assalamu alaikum. My name is Sarah Tugarb Abdullahi. I am a nurse. So I'm going to bring Dr. Zainab on camera now. Assalamu alaikum wa rahmatullahi.
Walaikum salam warahmatullahi wabarakatuh. Finally, sorry about that. We had some issues.
I don't know what happened. Actually, that button that I'm supposed to accept your request didn't work. We started all over again.
Yeah. So, mashallah.
Yes. You're welcome on board, Dr. Zainab.
Thank you.
So we are going to hear from the experts' view on rape from the pediatrician perspective. You're going to talk for 15 minutes, and we will have 5 minutes for question and answers. So,
Okay.
floor is yours, Doctor.
Okay. Thank you for having me. Good evening, everyone. Thanks for joining us. And I'm happy we're having this, tough conversations, about rape and all that. And then as regards children especially. So, just to begin with, just that people are aware that rape, the immediate effect of rape is on the survivor, himself or herself, before, the families and the environment. And even us as healthcare professionals, people assume that once a patient leaves, you've forgotten about that patient. No, it's not true. These stories linger with us, especially if we feel that patient hasn't gotten justice, or, we haven't solved the problem for that patient. So I feel like we should be part of the solution. So I'm really, really happy for this platform where I'll be speaking alongside some giants, in the medical field. Prof is going to be speaking and Dr. Mimuna as well. So I wouldn't really talk much about, the physical, effects that it has, in terms of things like pregnancy, sexually transmitted diseases. And I know Dr. Kadri is going to do justice to the mental aspect in terms of depression, sleep disorders, and all those things that, arise as consequence of this, heinous act. Now, from my own perspective, I know like in the recent year, a lot of cases have come to light, in terms of children getting raped and assaulted and all that.
Yes.
And I'm happy that we're having these conversations because let me just paint a scenario for you, right?
Okay.
I worked in Zaria at a point, and there was this boy who came in. He was about 9 years old, and there was a story that he had been sexually assaulted, okay,
Uh,
by an older man, right? Now, this man denied it. He said he didn't do it. And then this boy was sorry because he was 9 and he could identify him as the assailant. And when we examined him, there was evidence that, okay, he had been assaulted. But then the painful aspect was we couldn't, say, okay, yes, this was who did it, because the boy said it was him and he denied it. So that is why I wanted to talk about validation of the truth of the survivors. We
good.
need to be able to validate their truth, okay? I'm going to talk about how we can validate that. Another scenario I would like to paint for you is here in Abuja. I was working at the district hospital, and there was a 5-year-old girl who was brought in. She was sexually assaulted by an older boy who was in their neighborhood. Now she identified the boy and he admitted to doing it, okay? And when we examined her, the hymen was no longer there, there were bruises there and all that. But all we could do was take samples, to screen for these sexually transmitted diseases, HIV, hepatitis, and all that, give her some sort of prophylaxis, and then that was it. Our hands were tied. So in my head, I was like, okay, no social service workers. We can't liaise with the police to know this boy has admitted it, okay? So what next? What sort of justice are we getting for this girl and her mother? They were distraught. So again, in terms of justice, because we've talked about validating their truth, then justice. Okay? Now, sexual assault on children or on older people can be prevented, okay, but then it's always an uphill battle because of the complex nature of this act. It's always an uphill battle. So I
That,
feel like the prevention, we talk about it in the 3 stages: the primary prevention, secondary prevention, and then tertiary. Okay. So now, in terms of primary prevention, we're going to talk about things like how we can prevent the act from even happening. So in terms of prevention, we're talking about public enlightenment, we have to use social media. The world is now a global village. We should put that to use it to our advantage. Use social media, places of worship, churches, mosques, use other mediums like social gatherings to propagate this information, demystify all the myths surrounding sexual assault. Now, it's true, when you hear a woman has been raped or a child has been raped, the first question is, what was the woman wearing? What time of the night was it? Where was she? Those are the first questions they begin to ask. But how about that 3-month-old that was in diapers? Okay, are you going to ask what she was wearing? How about the little girl who doesn't even have breasts yet? Was she enticing anybody? So we have to make the public aware that the problem is with the rapist and not with the survivor. We have to let them know that you have to break your silence, okay? Because now, early last year, the Me Too movement took waves over the world, and in Nigeria, we had the Ariwa Me Too. I know we're encouraging people to break their silence. People were coming out to say, oh, yes, this happened to me too. But then what happened after that? Was there some sort of justice gotten for them? Were their stories validated? Did they have some sort of closure? No, because we don't have things put in place. So public enlightenment, trying to make people know that these things are happening and it's okay for you to come forward and you would get help.
Yeah.
Education. Yeah. The Universal Basic Education talks about providing free education for all children from primary school to secondary school. Because we all know that educating the girl child will boost the social economic status, the social cultural status of her, even as a woman in the country. And this is not to say that the boy child education isn't important, but we all know that the female child has been passed over so many times for her male counterpart in terms of education and other privileges. So if we now try to educate them, because this takes the children out of the classroom and puts them on the street to hawk and loiter, and then this now makes them vulnerable to sexual exploitation.
Yes.
So education, I think, is like very key in terms of preventing all this sexual assault.
Right.
Another thing is trying to create this parent-child, relationship, especially in the north. We don't have this where the parent and the child they have these conversations about sexual, development and all that. If the child is aware that I can talk to my mother about these things, then the parent is able to pick subtle changes in the character of the, of the child. They can, because all these children exhibit some symptoms, to show you that they have been assaulted before you even realize the truth. Okay? And then we try to identify the vulnerable groups. These are talking about children with special needs because they're the ones at risk, because some of them have problems with communication. Some of them have problems with communication, and they can't really, talk about this thing has happened to me. Some of them are deaf and dumb, so they're actually easy prey for these sexual exploitations. Okay, so we have to identify these groups and try to protect them,
right,
and put things in place to protect them, because protection of a child is on everybody, not just the parent. It takes a village to raise a child, right? So this lies on everybody. Then you talk about things like self-defense courses, just to, especially in older women, to show that, okay, if you're in this sort of situation, this is what you can do. Because most times they say that if a woman didn't put up a fight, then it was not a rape. It was a consensual act. Yes. That is what sometimes the media tries to portray and all that. So in terms of primary prevention, we change the narrative. We try to teach our boys, that no means no, right from the grassroots. It's not trying to tell your girls to stay at home or dress modestly. It's also teaching your boys what not to do. So this is all part of primary prevention. Now, in terms of secondary prevention, this is when the act has already happened. So what do you do? Okay, so prevention of sexual assault will continue to be a mirage if institutional frameworks are not put in place, and this needs political will as well. So in terms of institutional framework, I'm talking about things like functional, skilled, and synchronized services, talking about the police, the social services, the sexual assault workers, the criminal justice, coming together to form a system, to have a protocol. Like the scenario I painted for you, this is just a few of all the ones we've seen. Most times the parents will even say they don't want to press charges because they don't have the financial means to do so. They can't hire a lawyer, or they're afraid, or because of cultural norms or religion or stigma, they don't want to. But if you have a system in place, for instance, that girl that the boy had already, confessed, I'm supposed to liaise with the police to file a report as a doctor. This happens in the Western world. I'm supposed to, send them over to the social because I want to know what level of parenting this child has for the child to be so vulnerable. It happens even with the best of parenting, but you need the social care workers to come in to assist the mother, to help the child. So if these things, like in Lagos, we have the Mirable Center. There's a center you can call if you've been sexually assaulted. They offer you help, mental help, physical help, and all that. And I'm happy for this MASB organization, hoping that, blossoms into something like that, okay? And mirrors what we have in Lagos. I don't know in other parts of Nigeria, but we need things like that where you can, because I would have easily just reported these things and I would have felt at peace that this girl was going to get the help she needs, because I was just going to take care of the physical, but
Yeah.
she needs mental and she needs some sort of rehabilitation. And then the criminal aspect of it, where justice needs to be served. Because if justice is served, these, assailants, the ones that have, hope that in the future they want to be like that person, they will be afraid. By the time you're seeing people getting, the maximum sentence and all that in terms of rape, you'll be afraid. And this protects other people from falling victim.
Right.
Okay, so that, putting those things in place. In talking about that, for instance, the other scenario I painted where the boy said that man had assaulted him and he denied it. This is where we need forensic labs.
Yes.
I know we have one in Lagos that had been established some years back, but for by and large, it's being used for paternal suits. It's not being used for criminal forensics. Okay, these are the things we need. We find a case of assault. The person says this is the assailant. All you need to do is take samples. This is where rape kits, the safe kits, the sexual assault forensic evidence kits come into play. Everybody knows in the Western world that once you've been assaulted, do not take a shower. It's all over the media. This is when I talked about public enlightenment. Do not take a shower, present yourself. All these samples will be taken. And this is what you use to now say, this is the person. So this is one, validating their truth,
Okay.
validating their stories. That's the first step. They begin to have closure. Somebody believes me. Because when the Iowa Me Too movement started, it was very heartbreaking. People were saying, oh, these people are lying. People didn't want to come forward to say, oh, what was she wearing? Where did you leave your child? The parents get blamed, so they don't want to come forward. The story of Rukaya that was raped, a 3-month-old girl that was raped in Nasarawa. Imagine that. But because of things like this, money was raised in 2 days, Hausa mixed with other people, 2 million naira was raised. She was sent to the teaching hospital. So if people know that there are people that can help them, they will begin to speak up, and say, oh, this is me, this has happened to me. I'm going to get help. Now, for instance, the Child Rights Act, was passed by the UN. In Nigeria, it was adopted in 2003. Now, out of the 36 states in Nigeria, just 25 states have, implemented it. Because it's one thing to pass the laws at the federal level, it has to be implemented at the grassroots.
Exactly.
It has to be implemented by the state legislature, because if it's there, it's just there at the top. It's there in like now, even the bill for rapists, the sentence is here in FCT, but it has not trickled down to the grassroots. So even the Child Rights Act, it's talking about everything to protect the child in terms of child marriage and all that. Now, the 11 states that have not keyed into it are unfortunately states in the north, because religion has come into it and culture. Even in Islam, in the Hadith, it kind of mirrors the Child Act in terms of protecting the child. However, there are a few conflicts leading those states to say, "Oh no, we're not going to key into it," because in their head, it's kind of like employing Western tradition and Western rules, which contradicts what Islam is and all that. Because they've thought about, okay, you're saying the age for child marriage should not be the girl. You need the consent of the girl, unlike where they say, okay, you can just give consent and give your child out to marriage without her knowing. But the Child Rights Act is saying the child has to come of age, she has to be aware, she has to give her consent. Another thing is in terms of adoption. Once you've adopted a child, you have to let go of the birth parent. The child is now yours. Well, the Islamic, point of it is saying that no, you have to retain, the name of your birth parents. They still have rights over you. So these are the issues. So things like, public enlightenment, if we can reach the stakeholders in all these communities and involve them, then we begin to see these changes. That is responsible. Like again, I said that's why I'm happy for things like MASFeed and other. It needs to cut across the portfolio, across all levels of government, health, justice system, every other stakeholder, non-governmental organizations have to come together and help. Because especially in terms of child rape, it is very, very sad because one, they're vulnerable, and 85% of the assailants are not strangers, because you have different types of assault. You have the stranger assault, you have the acquaintance assault, and then you have the non-acquaintance assault, which is almost the same thing as the stranger assault. But most of it is done by people these children know and trust.
Exactly.
So, so until we begin to put things in place, because you can't, especially during the pandemic, during the lockdown, these cases began to rise. because sometimes the only escape these children have from their assailants is going to school. But
Yeah.
now they're in the house 24/7. Their caregivers are frustrated and they take out their frustration on these children. So they have no form of escape. So most of them are people they know. So many times a patient will come. Like one time a child came to me. She was 7 years old. The mother was, sad and all that. And she was saying that the child was having some sort of discharge. It was foul smelling. When she peed, she would cry. If she tries to wash her down, that the girl would just, she would scream and all that. So when I examined the girl, the hymen wasn't there. There were some bruises around her vulva. And then I began to ask questions. Who do you live her with? Who stays with you? She was like, oh, no, it's just her and her husband, okay? And when she goes to work, the husband isn't working right now. And at the end of the day, when with everything, the father isn't the girl's real father, right? And he was the one assaulting the woman because she kept saying it was her father. And he was the one assaulting this girl for a very long time.
Oh my God.
And we just realized that then. So imagine a scenario where, like, my hands were tied again because there was nothing. Because the woman said, "Oh no, she didn't want to report it. It's her husband and all that."
That's
In a place where things were put in place, I would report to social, services. I'll have that child taken out of there, out of that toxic situation, or some sort of justice because the mother is refusing to report and there was nothing I could do. My hands were completely tied.
right.
The same thing happened, a child who was 6. I cried that day because I came in, one of my chiefs was consulting, it was the HIV clinic for children, and the girl was there and then she was just playing with, we have this huge teddy bear in the clinic and she was playing with it just so innocent, to show you how innocent this child was.
Yeah.
And I realized that she was in the clinic, that means she was HIV positive, okay? And the mother was saying that, that she wants drug for like 3 months. And we said no, because we need them to come back so that we check up on them. And she was saying that she needs because she keeps lying in the school, keeps lying to her husband when she's taking the girl every month for the checkup for this medication. And we found out it was the woman's younger brother who had assaulted the girl when she was 4. So this has been, like, the child has been positive for 3 years.
Oh my.
And the husband was still unaware that it was the girl's uncle, his wife's younger brother, that had assaulted the girl, and the guy was still living in that house. And I remember my chief was so angry with her, and then she started crying. So that she doesn't know what to tell her husband, it's her brother. And in this case, like, I would have easily reported it, because we don't have something like that in place. There's no institutional framework to do so. So unless these things come, we can't protect these children. We can only pass laws, be on TV, pass laws, speak big grammar, and spend so much money. But these children are still vulnerable. They're still suffering. Their truths are not validated. They're not getting justice.
Exactly.
And they can't. And at the end of the day, in terms of tertiary, rehabilitation and all that, studies have shown that most children that were sexually abused are the ones that grow up to be abusers themselves, especially if they don't get some sort of rehabilitation. It affects them on the long run. I know Dr. Gadri is going to do justice to this, but it affects them in the long run in terms of future relationships. Some of them end up becoming homosexual because if it's a girl who was assaulted by a man, she feels some sort of hatred towards men.
Yes.
And because the way nature is, you want to feel some sort of closeness to another being. They end up finding that comfort in the arms of somebody who they see as themselves, which is another female. So these are the issues we have to look at. They need rehabilitation. It's not enough to say, okay, they've gotten justice. They need rehabilitation.
Right.
They need justice. They need closure for themselves and their families. I don't take up too much time. I know my time is up, but I could go on and on and on, talking about, these things. But then these are things we have to do.
It was that if you have any question for Dr. Zainab, you can please type in your question here. I can read it for her so that she can give you the answer. For now, we don't have, like I saw G Mami said she has 2 questions for you, but
Okay.
write the question. So Dr. Zainab, if you have something to add, you can still add within your time, please.
Okay. So what I would like to say again is that, like I said, it's not just on the government. It's so easy for us to sit behind our keypads. Is rape on the rise in Nigeria? Is it a case of us being aware more? That is a very, very valid question. When the Arewa Me Too movement started, I remember I was talking to a few colleagues and they were saying, oh, wow, is it that people are now becoming more sexually active? I said, no. If you look at all these stories of the Arewa Me Too, the people were coming, these stories were coming from decades ago, from people when they were in secondary school, from children when they were maybe 15 years old, who have now come into adulthood, who are now reliving this past. Because most of them relive it day in, as if it just happened yesterday. So no, I don't think, Lady Nazif, I don't think it's on the rise. It has been there for a long time, just that people are now becoming aware that, okay, I can actually speak up, I can break my silence.
Yeah.
That's what I'm saying. We should buttress that to encourage more people. But if you speak up and break your silence, something needs to be done. It's not about a movement or a hashtag on social media.
Yes. Yes.
Yes, I was raped too. Something needs to be done.
It's
If that person is still alive, that thing might still be ongoing. That's when serial sexual assault comes into place. The likelihood that that person did it and got away with it, that person has continued it. So it's time for us to realize that if I speak up, something can be done to prevent the other victim from suffering or somebody else from falling victim.
Here comes the question. Gogomami asks that does a child who has been sexually assaulted need periodic examination?
Well, what happens when a child is sexually assaulted? When they come in, the first examination, we examine them to see, like, what has happened. We look at them holistically. We look at from head to toe before we even get to genitals and all that. We look at the physical aspect. If there are any wounds, we treat the immediate problem.
Okay.
But then again, like I said, there's no system in place. Abroad, what they do is after the physical examination, when they refer you to these social services, there's something else that comes up. They reach out to you because you're going to have series of sessions with them. It's not just a one-off thing and they see you and you go like, what happens here in Nigeria? Most of the patients I've seen, I never ever see them again. Some, I give the mothers my number if they just feel like talking, just to offer some sort of, shoulder to lean on, because I know I can't do beyond that. I can't give justice. Yes. But then abroad, so this is what I'm asking for. Like, let's have a system where they're followed up. Because normally in medicine, if a child comes, they were on admission and we discharge them, we keep following up for a number of, we give them maybe a week appointment, 2 weeks, until we feel that, okay, this person is ready to let go of you, especially with children. The same thing we do for the HIV patients, with children in our clinic. So these are the things that have to be put in place. Hopefully, that takes root here. Can we actually blame our culture for repressing those that have suffered? Oh, absolutely. I think we can blame culture, we can blame religion, we can blame the society, we can blame so many people, but not the victim.
Yeah, not the victim.
The only person we can't blame is the victim, because we've not. Who doesn't want, a helping hand? Who doesn't want help if help is offered to them in a constructive manner? I'm not going to come out and tell you my story. To what end? You're not going to give me justice. You're not going to give me some sort of closure. So I will not come out and tell you I've been raped if all I'm going to get is judgment. So I think everybody is to be blamed in terms of people speaking up about, rape, not just culture, even our family and, people around us, especially, that you feel you can't even talk to and, own up to.
Yeah. Okay, thank you very much, Dr. Zainab. This was very insightful. We thank you so much for your education, for your enlightenment. Thank you very much. We are going to relieve you now and invite our next speaker for this session. Thank you so much. And
thank you. Thank you for this platform.
Thank you.
All right, bye.
Yeah, Assalamu alaikum. Yeah, viewers, that was Dr. Zainab with her elaborate discussion on rape from the pediatrician perspective. The next speaker that we have is Dr. Maimuna Yusuf Kadri, popularly referred to as the celebrity shrink. She is a multiple award-winning mental health and physician and advocate. She is a dynamic consultant neuropsychiatrist and a fellow of the National Postgraduate Medical College of Nigeria. With over 18 years experience as a practicing physician, she is trained and certified rational, emotive, and cognitive behavioral therapist from Albert Ellis Institute, New York, United States of America. She is also a certified trauma counselor and neurofeedback practitioner. She is the medical doctor and psychiatrist in chief at Pinnacle Medical Services, Nigeria's leading and foremost psychology and mental health clinic, prominent in the application of innovative clinical approaches in the management and treatment of a wide range of psychological, emotional, and behavioral related disorders. She is the only Nigerian with the 11 Ps: physician, psychiatrist, psychologist, psychotherapist, practitioner, public speaker, publisher, producer, parent, people-oriented, and passionate about God and life. She's the founder of Pinnacle Health Radio Africa, African #1 online health radio on a non-for-profit organization. Pinnacle Medical Speak Out initiative, which is geared towards creating mental health literacy in Nigeria and beyond. Her driving force is to live, to learn, and to impact generations positively. When not working as a physician, she loves to tour the world, work on disruptive innovations, and talk fashion. Dr. Maimuna Kadiri is a life coach, an innovator, and she is married with 3 lovely children. So I am going to bring Dr. Maimuna on camera now to give justice to her topic. So, Dr. Maimuna, we are waiting for Dr. Maimuna to come.
Yeah.
Oh, Dr. Maimuna.
Assalamu alaikum.
Assalamu rahmatullah.
Good evening, everyone. Thank you very much.
Yes, so hello viewers, this is Dr. Maimuna, and I'm going to let her
take the floor. Well,
yes,
thank you very much to Masbi for this awesome gathering. And this is something I'm quite passionate about, and it's something that we've been in that space for a long time. Currently now is the COVID-19 pandemic, but even the United Nations is looking at it that there are 2 other pandemics that may brew out of this current pandemic. 2. The first one is gender-based violence, where we do have the rape, the domestic violence, and all. The second one is the increase in mental health related challenges. And I'm so embedded in this space right now, and it's causing a whole lot of challenge. Now, but everybody that is on live this program, and of course I will watch it afterwards, I want us to take away from this. This pandemic, if you're a parent on this platform, aspiring parent, a guardian, an aunt, an uncle, of course, definitely you are in a way parenting somebody directly or indirectly.
right.
This pandemic is going to go and, come and go. And it's going to affect us in many ways, politically, economically, financially, and otherwise.
Right.
But there's one thing that we have to take away from this. Our children are not going to see how this will affect us in the next 5 to 10 years. But one thing they are going to recognize is the way we made them feel. So dear parents, aspiring parents, uncle and auntie, daddies and mommies, please make it count. We are having almost a pandemic because it's not a pandemic because it's not yet announced. We never knew COVID-19 would be a pandemic until the World Health Organization announced it, of rape cases. And the issue with rape cases now is more from fathers to their daughters. It just goes to show us in the mind of a rapist, what is going on there? What is a rapist telling himself or telling herself? Because sometimes it's the other way, but it's more from the male to the female. What are they telling themselves that will make them to be so bold to take on board a child that is as young as 2 weeks or 3 weeks old? What is that child having? Completely nothing. No breast, nothing. And then you are saying, something came upon me. Is the devil? Which devil? Who does that? We've seen as young as 3 years old to as old as 87 years old in my facility. And that 87 years old was actually raped when she was 12. So you can imagine 75 years later, a whole 75 years later, that a lot of us may not even live to that level. She is now suffering from depression because she has not forgiven her rapist. She didn't find closure. She didn't grieve because when it happened, the majority of the questions were, what was she doing there? Who sent her there? What in war? You don't talk about it. You will disgrace our family. Please, people will not, you will not get a husband.
Right.
We as a nation, right? It is easier, cheaper to nurture a healthy child than to manage or fix a damaged adult. If we understand this, we will begin to start building a culture of compassion where people can come up, speak out, and speak up, where they can talk to us without them being judged, without them being criticized, and without us, especially Nigerians on this platform right now, we are not going to be apostolic towards them. We are not going to tell them because they are not fasting and praying enough. We are not going to tell them because during fasting period they are not fasting the whole 30 days. We are not going to tell them because of the church they are going to is not good. Follow me to my own church. We are going to climb the mountain. Stop it.
Yeah.
The long time effect that a rape survivor goes through is terminal. Most of the rape cases, I wasn't there. Nobody working with me that up to the 30 or more staff that I have were there. But we begin to start seeing them now because of the challenges that they are going through. And we have to take them back to that history, reopen the wounds, and make them to reenact the whole story to tell us how exactly is it doing them, if I want to use the Nigerian way. Because nobody listened to them. And for those of us that are mommies, when your child tells you, Mommy, I want to tell you about uncle that is doing XYZ, don't shut that child down.
Yes.
You shut that child down, you've just heard 1%, 99% you didn't hear. And that predator will continuously go with what he's doing and you will never know. And if you are married to a man that is not the right father or the real father of your child, please, dear mothers, don't be stupid. Don't be wicked to keep quiet and let what is happening to that child happen to that child. And tell the child that don't break up my marriage. What rubbish marriage?
Yeah.
Let me tell you something, mothers. If you are in such a situation, there's what we call Maslow hierarchy of needs. When you grow older, there's what we call self-actualization.
Right.
Ask yourself, when you grow older, will you actually be self-actualized if you know your child is going through a long-time debilitating effect from the rape that she went through? I never call them rape victims. They are survivors. As far as they didn't die, they didn't break, they are surviving. So what we do is not just to make them to just survive, we want to make them to thrive against all odds. Yes. Because one of the risk factors when it comes to vulnerability risk factors for mental illness is child sexual abuse.
Right.
So please, if you don't know this today, understand that child sexual abuse is a vulnerability risk factor that if somebody has as a child can come haunting her or him later in the future.
Right.
And because of this, they can easily go into any other mental illness. So I came up with 2 acronyms that I want us to be relatable to before I round up my session. The first acronym is RAPE, and the second acronym is survival, because this is pertinent to this discussion. So when somebody is raped, immediately what goes through that survival's mind? REPE. Yeah. The R here is regret. Okay. Maybe start because of the kind of family most times they are coming from. Maybe if I didn't do this, I should have done. Maybe, oh God, why did this happen to me now? No, regret setting. Yeah. The A here is anger. So you see a child who has been raped, all of a sudden, a child that was very calm, collected, and all that, prim and proper, start showing anger. In fact, sometimes even gets to tantrums. Yes. If you're a parent and you don't pay attention to what has changed in your child, then you are missing something. Because any child that you are parenting now, the moment that child turns 18, you are fixing a damaged adult. So parents, parent your children till 18 years. Anything above 18 is fixing a damaged adult. So the A here is anger. The P here is pessimistic feeling about themselves. They start seeing themselves with self-worth issues, they start looking down on themselves, they start feeling bitter about themselves, they start becoming pessimistic about the whole thing. The world should end. Oh, I'm just tired of everything. Mommy, what if I just disappear? Mommy, what if, tomorrow you wake up and I'm not alive? And the E here is esteem issues. It enrolls into their self-esteem, their self-worth, their self-confidence. And what you will see as a parent or a teacher is poor academic performance. But what exactly is happening to that child that's leading to poor academic performance? These are the immediate effect you see. The short-term effect you see using rape again is restlessness and poor sleep. They may even start having bad dreams. They may even start having, thinking of so many things. They may not even be sleeping well, and they start losing weight. The A here is alcohol and drug abuse. They go into drug abuse and you'll be thinking, why should my child be taking drugs? They are trying to kill that pain that they are going through because you didn't give them room to discuss it. The behavioral issues regarding our law enforcement agency, they are there. Madam, take your child home. This is a domestic issue. How can you come and complain to us here? So the alcohol and drug abuse, they're going to find out why are they even using alcohol? Why are they even abusing substances? The A yet, it can be personality changes. So the child may be very quiet, all of a sudden is everywhere. Because sometimes when they go through this rape, they just believe that if I start giving it out to anybody, I'll be fine. I'll find closure. So the personality will change of this individual. And the last one here on short-term E is experiencing suicidal thoughts. Some have actually killed themselves. I know of a 9-year-old that killed himself. Not necessarily from rape, but from cyberbullying. So please, children also get affected. Children also get depressed. Let's not say what is making a child depressed. After all, there's a roof over his head. I pay school fees. Don't count all those things. They're not interested. They want you to listen to them. And now let us go down to the long-term effect, because sometimes when these people, children or adolescents or adults are even raped, a child can come out from it. I know this is a long-time effect. You continuously see this child and it's reminding you of that person that raped you. How traumatic can that be? So when you look at the long-term effect, the RES relationship challenges. They don't form formidable relationship. The girl is 40 years old. She's not yet married. She's this one, that one. They start abusing her. Or she goes into marriages and comes out for me.
Exactly.
Or she's a bazaura. This. She's no, the Nigerian will say it's a shower. She's this. Because people don't understand that this person cannot keep relationship. She feels traumatized. She cannot trust enough to stay in a relationship. Most of our relationships are platonic. Even amongst our females, she doesn't trust people. So trust issues enroll there because of the relationship challenges. The A is anxiety and depression. And let me let you know, as Nigerians, 1 out of every 5 Nigerians is currently depressed. So if you are 5 people in the house right now, count yourself. 1 of you is depressed. If you think you are not the one, somebody around you is depressed. And I'm not talking about depression on the road or the people picking trash or eating from the dustbin. You can have smiling depression. You can have high functioning depression. And these people are so productive, but you wake up one day and the person is dead. So the anxiety and depression setting. And another long-time effect, which is representing the PES, post-traumatic stress disorder.
PTS. So
rape has been done. We sent to Dr. Zainab, they examine, everything is fine. 3 to 6 months later, this person is having flashbacks, hyperarousal of what has happened, cannot coordinate herself. Post-traumatic stress is a diagnosis that can only be nipped in the bud 3 to 6 months following a traumatic experience. It's not immediate. So PTSD, which is the post-traumatic stress disorder, is one long-term effect that some people are currently living with because of the abuse they've experienced. And let's not forget, when it comes to rape, it's not just single. There's intimate partner violence, whereby a husband will rape the wife. And what will she tell to? Even our best friend will not believe. I said, go and sit down, Memuna. How can you say your husband raped you? They do. And it's even, we acknowledge it. But people will trivialize our issues, whereby she will not be dying right there. And the last of the long-term effect in the rape acronym is emotionally unstable personality disorder. So they've just found out themselves, they can't just keep, you see the person who just withdraw either a schizoid or schizotypal kind of personality. They're just unstable. In the morning, they are laughing, in the evening, they are crying. You don't even just understand what the individual is going through. Yeah. Now let's go to the survival. And I will quickly run through the acronym so that we can have questions before my own session runs out. When we talk about survival, we're talking about people that have gone through this process. And of course, we acknowledge it. And any emotions they are going through is valid. Please don't ever trivialize what they are going through. And if you are going through that process, we have to encourage them to build that culture of compassion. So the S here is support. And this support is not just from the family. Support should be from the legal sector, the health sector, the family, the religious, culture, and media. The media shouldn't say she was raped. Rather, he raped her. The moment you say she was raped, it's as if she brought it upon herself. Let us begin to start reporting cases responsibly. Let's report them the way it is. Let's not discriminate and stigmatize survivors. We have to report them responsibly.
Right.
So the S is the support that they get. The U, yes, they have to learn how to unlearn and relearn new ways to be happy and build trust. Unlearn and relearn. It's a very good way for them to find that joy against all odds. The R here is they have to reach out to other support groups. So if you find that somebody who is a survivor, please encourage them to reach out to support groups out there, because there's a common denominator there. They are healing together, so they can all work together, and then, of course, that can fast track their healing process. The V here is validate your feelings. As a survivor, try as much as possible. You do not need validation from anybody. You just need to validate yourself. The person you should be better than the person where you were yesterday. Don't compare your healing process to another person's healing process. And the I is imbibe only the positive thoughts. A lot of negativity will run through your mind. Suicidal thoughts, you hate yourself, you want to kill yourself, this life is bad, I don't want to live. Please, as much as possible, imbibe those positivity.
Right.
Look for those kind of people that will help you heal. The other V is verify information before consuming. There's a lot that'll be online. Do this, do that, like the COVID now. Take ginger, take garlic, go and do this, you don't need everything. Know what works for you. So every information you get, please verify it. It will help you in your healing process. The O here is please opt to forgive yourself, so that you can create room for yourself to forgive that person that raped you. That is very important. Yes. Exactly. Forgive yourself, opt for that forgiveness. You need it to heal. It's very, very pertinent in your pathway to recovery. And the R here, resist stigmatization and seek for help. We all need help at one point or the other. It's okay not to be okay at times. When you need help, seek for help. It's a sign of strength, not necessarily a sign of weakness. And the last but not the least, self-care, self-love. Embrace it with all your heart. It's called self-preservation, not necessarily, selfishness. You need it. You've gone through a lot of trauma. Nobody can actually understand exactly what you went through. Even if the people in your support group went through rape too, but they will not understand exactly how you went through it.
Yeah,
because they don't.
Perspective. Yeah.
Exactly. So it's from your own perspective. So embrace self-care, embrace self-love. You deserve it. You are enough. You are a survivor. And I wish you the very best. Thank you.
Thank you very much. We have some question here. Even though your time is almost up, but like one or more question. This question comes from Gogomami. She said, "How do you make a little child believe he or she must confide in their parents on feeling uncomfortable on certain people, even if they are family and friends?"
So I like this question because we do have this assessment in our facility. So when you're doing forensic assessment, especially when it comes to children that have been raped, they cannot really explain exactly what has happened to them. So we have these teddy bears that depict grandfather, grandmother, mother, father, siblings, aunt, uncle. That way, when it is being suspected that that child has gone through such violation, you let them play therapy. You put up a play area for them. They will tell you what is happening. You will notice the non-verbal communication that child is experiencing while playing or talking to these toys. When you bring in the grandfather and the child is like, no, don't take him back. What is it about this? Sometimes parents will say, I don't understand my child, and we'll just say, let us just do this. We'll find out that is this child has been going through molestation or even sodomy right there under their place. So for you as a parent, how will you make sure that your child can talk to you? Please make your home climate right. There's what we call home climate. The way you have temperature, room temperature for when you want to sleep. Your home climate is very key for your children. Yeah. And what is that? Having the right climate for your children. The home where there is laughter. A home where the children can be able to talk to you without them clenching that mommy is coming and everybody is walking on eggshells. A home where Baba is coming, people and the children are not running away. You must build the right home climate for your children to thrive. They are your legacy. They are your future. And if you failed in doing that, it's upon you to, because maybe you are not emotionally stable, seek for help so that you can help your children.
Right.
So that is what you need as a parent.
Okay. Thank you very much, Dr. Maimuna. We are going to relieve you now. And I hope all of you, the speakers, because like you speak so much well, and we need the MarsB would love to have all your content so that we can put them up on our website also for viewers to see. Inshallah. Thank you so much.
Thank you.
And that discussion was so much robust. It was so good and so educational and insightful. Thank you so much. We are going to give you now and invite our next speaker for the day. Thank you so much.
Thank you. Thank you, everyone.
Yes, that was Dr. Maimuna, a psychiatrist, psychologist, and also cognitive behavioral therapist. So we are going to have our last speaker for today, and she's none other than Professor Hadiz Shehu Galadanchi. I'm sure when I say this name, it rings the bell because like it's a household name. Professor Galadanchi is an obstetrician and gynecologist at Aminu Kano Teaching Hospital, and she is the director of African Center for Excellence for Population Health and Policy at Bayero University, Kano in Nigeria, which is a World Bank supported center. She is dedicated her life to helping women face challenges regarding their reproductive health and effect of gender dynamics in their health. She is passionate about reduction of maternal and child mortality and reduction of cervical cancer, with about 100% publications in high impact journal. Wow. She is a master trainer in both undergraduate and postgraduate studies and an external examiner to 8 Nigerian medical schools, West African College of Surgeons and Makerere University, Uganda. She has served at various times as a consultant to development partners, including UNICEF, Pathfinder International, ISBN, and UNFPA, MNCH2, to mention but a few. She is a member of committees, council, rural boards, board of trustees of various national committees, regional committees, and non-governmental organizations. She is the founder and medical director of Standard Specialist Hospital in Kano, and she is a proud grandmother. So I'm going to bring Professor Galadanchi on board now so that we can benefit from her wealth of experience and knowledge. So we are waiting for Prof to be on board now. Assalamu alaikum, Prof.
Amin alaikum assalam, Haja Saratu. Nice to join you.
Nice to have you here, Professor.
Yeah, great.
So the floor is yours now, Prof.
All right, thank you so much. I will start by thanking MarsB for inviting me for this very educative, interactive, and necessary video conference, and I think it's something that we have to do because the awareness has to be created, and this is one way of doing that. So thank you so much for putting this together. I think Dr. Zainab and Dr. Maimuna have done justice to this topic. So what I'm going to do is just add a bit, as I said, from the gynecological lens. So I'm looking at it as a gynecologist and of course as a mother, as an advocate for us to really stop sexual abuse and sexual assault. I will start with 3 short stories just to emphasize, because I think it's very important to bring home what we are saying. Doctors, the 2 doctors have really tried to do that.
Yes.
The only time that I cried in front of a patient, years of practice was when a parent's mother and father brought a 6-year-old that has been sexually molested by her teacher over and over and over. At that time, my youngest daughter, the only daughter I have, was just about 6 years old. And then this girl came into my office and I was told of what was going on. I didn't know when tears started coming down my face. Now, that is one. I've seen a 6-month-old baby. We all know about the story that happened in Kano. She was brought to Aminu Kano Teaching Hospital. She was brought to my hospital, Standard Specialist Hospital. 6 months old that was sexually assaulted by a husband of a friend of her mother.
Yes.
Now, then I've also seen a young girl who was married off in a village, and whatever the husband was doing to her, at the end of the day, she could not control feces and urine. And she was brought to me. In fact, the emir of Kano, the former emir of Kano, was the person that sent to me. And we had to pack her and send her to India for repairs. Now, this is the story, ladies and gentlemen. This is the story that we're faced with. So what are the statistics? Well, we know that rape can be sexual assault. It can be part of domestic violence, as we've had. It can be what we call more or less sexual, I will say maybe just a second, sexual violence, sexual abuse, sexual assault, and is part of domestic violence. Now, what is the statistics? How much of this is happening in Nigeria? We know that of recent, especially because of the COVID, we've had so much of it that there's so much movement about it. But really, we really don't know the numbers, because 1 out of 5 is the only one that is reported to the police. Some people say we have like 2 million occurring every year. Some people say that it's about 11% to 55%. I've seen statistics from journals saying that, you know, they have asked either secondary school students or university students, and you can have as much as 55% saying that they have been sexually assaulted or sexually molested in their lifetime. So it is really a silent epidemic. And as Dr. Maimuna has said, it is really another pandemic. Apart from COVID, it is really another pandemic. Now, so we as gynecologists, how do we see these rape cases? A lot of times these rape cases end up with us before they even get to see either the pediatricians or they get to see the psychiatrist, because they have bruises in their genital area. They can have bruises in their face, in their neck, in their buttocks, in their vagina. They can have tears in their vagina. Just about a month ago, I saw maybe 11-year-old, and they said, you know, she had a laceration in her vagina. I came for a round, and I saw that they were rushing her to the theater because she was bleeding profusely. And then they told me she fell down, you know. But I know it's a lie. She didn't fall down. Somebody must have done something to her. But they said that she fell down. You know, so you can have tears, you can have lacerations. At times the tears are mild. We can just give some medication. At times, a lot of times we'll have to take them to the theater so that we can suture. And as I said, I've seen somebody that is licking urine and licking feces, because the whole of her vagina, above the vagina is the bladder where you pass your urine. Yes. Below the vagina is the rectum. So the whole of that area has been destroyed. And therefore, she cannot control feces and urine. So these are part of the injuries that can happen to rape cases. Now, the other very important thing, and Zainab said that a young girl of 7 had HIV. Where did that girl get HIV, for goodness sake? Because her uncle has molested her and he had HIV. So you can get all the sexually transmitted infections. You can get gonorrhea, you can get syphilis, you can get chlamydia, you can get trichomonas, you can get herpes, you can get hepatitis, you can get HIV. a 6-year-old with HIV, it has to be because she can't get it anywhere else unless she's had blood transfusion. So all these infections can occur. So as soon as they come, in fact, we have to do all tests for them. If we do a HIV test for you, for a patient, if she has RIP, in fact, even if it's negative, we tell them to come back after 3 months, because at that time you might not get a positive.
Yeah, sorry, I think the network from Professor side is.
Am I okay? Yeah, I'm sorry. I think the network has not been too good here. So they have to repeat the test again. So we have to do all the sexually transmitted infection tests. We have to take smears. We have to take smears from the vagina, from the vulva, from the rectum. We have to even comb the pubic hair, because actually you can see the pubic hair of the assailant, because Zainab said so. You know, there's so many procedures. So we have a protocol where you have to do all this so that at least you can say who that person is. But of course, you know, at the end of the day, as I told you, that young girl, the parents told me, please, doctor, because I was ready to go to court. I was ready to go and testify. Please, doctor, we don't want you to do anything. Please, doctor, it's her teacher. Please, doctor, you know, it's the community. Please, doctor, she will not be able to marry again. Please, doctor, even her sisters are not going to be to get married again. So please keep quiet. And that's how we had to keep quiet, because we can't do without them. You know? So even though we do all these tests, at times they're not useful. We just keep it in the folders because parents or patients will not come back for it. But for us as practitioners, that is what we're supposed to do. Now, one other terrible thing is pregnancy, and I think Zainab said so, or Maimuna said so. I've seen a who her parents, her mother brought to me 2 months after armed robbers entered their house, and they did not know that these armed robbers raped her. And she did not tell anybody until when she had not seen her periods for 2 months. And the mother noticed she has not done her periods for 2 months. And then the mother asked her, and the girl started crying and told her what happened. And they brought her to me. Now, what are you going to do, for goodness sake? What are you going to do? Armed robbers that you don't even know who they are haven't raped a young girl.
Yeah.
So that is the situation. So pregnancy is a major complication following rape. Now, of course, if it's a woman that is married and she is on IUCD, on contraception, then we are okay. If it's a young girl that is not going to be able to get pregnant, then we are okay. But if it's a young girl that has already started her periods and she can get pregnant, then trouble for us. Now, what we do is we give emergency contraception. We have drugs, we have other ways that we can give emergency contraception so that at least immediately the rape occurs. When you take emergency contraception, the chance of you getting pregnant is very, very minimal. But if you keep quiet and come after 8 weeks, after 12 weeks, then you're pregnant. All right, so that is a very terrible thing happening as a result of rape. Now, the other thing is that, as I said, we take all the smears, all the clothing, all the pubic hair, all the fingernails, all of them, so that we can at least send them for forensic evaluation. Now, Dr. Maimuna talked about the emotional aspect. Now, this emotional aspect, you cannot really understand until you have seen somebody that has gone through this problem. Then you will now understand and bring it home. So it starts with the acute phase, which has said. You can have sleeplessness, you can have depression, you can have guilt, you can have fears. Especially a young girl should be screaming at night. You know?
Yes.
And so a lot of times, you know, the psychiatrist and the psychologist, as Dr. Maimuna said, will have to give tranquilizers, will have to give different drugs so that at least this acute phase will subside. Now there is the late phase, which also Dr. Maimuna talked about. Now that late phase, I see part of that late phase, and one of them is that there is fears. I have seen people that are married and they have not allowed their husbands close to them for 6 months.
Oh my God! Yeah,
6 months, starting from 3 months, 4 months. When the husband at the beginning, he's okay, 1 month, 2 months, 3 months. By 4th month, he starts complaining.